How can you support your child when they're having a panic attack or they are in a high emotional state? Let's talk about the ice cube technique. The ice cube technique is a way that we can reduce big emotions quickly. This is a distress tolerance skill that therapists teach in dialectical behavioral therapy, also what we call DBT for short. We refer to this coping strategy as a TIP skill, which stands for temperature, intense exercise, paced breathing, and paired muscle relaxation. The ICE technique falls under the temperature category in TIP. These skills are an effective and very easy to remember set of healthy coping strategies and great tools to have handy in your wellness toolbox. This is an easier skill to remember to use in times of crisis, in times of panic attacks, or any high emotional states. In the midst of dysregulated emotions, racing thoughts, and hyperventilating, individuals try to find something, anything, immediately to make whatever it is that they're feeling stop. We want to feel better, and we want to feel better quickly. Youth might express emotions by way of outbursts, by yelling, throwing things, and engaging in negative coping skills such as self-harm. Utilizing this skill, once taught to your kiddo, encourage them to use it when they recognize that they're in a heightened emotional state, as it can be done later without your guidance. The ice cube provides an excellent distraction, and the physical sensations that come from holding onto the cube will draw their attention away from the current painful emotions that they are feeling. By holding it in our hand, it causes our body's chemistry to change. Our parasympathetic nervous system, which regulates our rest and digest functions, is now activated to prompt a relaxation response. So it then slows down your heart rate and it slows down your breathing, which is the complete opposite of the sympathetic state that we're currently feeling when we're in those heightened states. This is also what we call the flight or fight response that causes the accelerated heart rate, breathing, and those feelings of panic attack. To help guide your child, you might ask them to just notice and observe the sensations and thoughts they're feeling as they hold on to the ice cube. This is going to take them from feeling elevated, lost in their thoughts, and stuck in that stinking thinking, and help them feel more grounded, more present, and back in their body. This distress tolerance skill can be done at home, and it can also be something that a child can do at their school. Most school offices will carry ice for all those bumps and bruises on the playground. Have the school staff create a safe space where your child can take a walk to the office and access some ice if needed. And lastly, adults. The physiological effects of this skill work the same for us, which means that we can also benefit from this very effective, healthy coping strategy. So be sure to keep this skill available in your own wellness toolbox. Please check out my other videos where I explain distress tolerance skills under each of the TIP categories.